Today we will be discussing the preconception counseling of a patient with a chronic hypertension. Okay, this is basically the NICE guideline about hypertension in pregnancy, and in the previous videos we have discussed the other important points. Like first we discussed the strategies to reduce the incidence of hypertension in the pregnancy. Then in the second video we discussed the assessment of proteinuria in a patient with a hypertension in the pregnancy. And now this is the third video regarding the NICE guideline about hypertension, and it discusses the preconception counseling of a patient with a chronic hypertension. Okay, so first of all, it is written that offer the woman with a chronic hypertension referral to the specialist in the hypertension disorder of pregnancy to discuss the risks and benefits of the treatment. That is what we have to do first of all. Okay, in 2010 it came out and it was amended. Okay, in 2010 it was described in this NICE guideline about hypertension. It was amended in 2019. Okay, the second important point is that we have to advise the woman to who take angiotensin converting enzyme inhibitors or angiotensin receptor 2 blockers certain important thing. Okay, we have to give specific advice to these patients. So what are those advices? The first advice would be that there is an increased risk of congenital abnormalities if these drugs are taken during pregnancy. So they have to avoid or they have to stop taking ACE inhibitor or angiotensin receptor blockers. Another important thing which we need to discuss with them is that we need to discuss alternative antihypertensive treatment with the healthcare professional responsible for managing their hypertension if they are planning pregnancy. Okay, so we have to give something for hypertension anyway, so we have to discuss with them. We have to say that leave those medications, ACE inhibitors and angiotensin receptor blockers, but discuss alternative antihypertensive with their healthcare professionals. Another important point is that we have to discuss alternative treatment with the healthcare professional responsible for managing their condition if ACE inhibitor or angiotensin receptor blockers are being taken for other conditions like renal disease. It is not necessary that the patient is taking these medications for hypertension control. Sometimes they may take it for renal disease as well. So we have to look at the pros and cons of the stopping the medications. Okay, and another point is that we have to stop antihypertensive treatment in a woman taking ACE inhibitors or angiotensin receptor blockers if they become pregnant, preferably within 2 working days of the notification of pregnancy, and alternative offer alternative. Okay, so when we have to stop, we have to stop preferably within 2 days of notification of pregnancy. As when the pregnancy test is positive, then as soon as possible within 2 working days they have to stop it. Now, another important point is that advise the women who take thiazide or thiazide-like diuretics that they may be an increased risk of congenital abnormalities and neonatal complications if these drugs are taken during pregnancy. So not only ACE inhibitor but angiotensin receptor blocker, but also those women who take thiazide diuretics, we have to do their proper counseling. Okay, and to discuss alternative antihypertensive treatment with a healthcare professional responsible for managing their hypertension if they are planning pregnancy. Okay, and another point, advise the women who take antihypertensive treatments other than ACE inhibitors, angiotensin receptor blockers, thiazide-like diuretics that the limited evidence available has not shown an increased risk of congenital malformation with such treatment. So it means that basically we have data or research evidences available regarding the non-safety of few medications like ACE inhibitor, ARBs, thiazide or thiazide-like diuretics. Regarding the other medications, we do not have sufficient data available. Okay, so we are not sure about the safety of those medications. So the better thing would be to take only those medications in the pregnancy for hypertension control about which we have sufficient safety data available. Okay, so basically we studied these few important points in the preconception period. Especially we have to emphasize on the drug she is taking along with the other information which we give generally to the patient. So that was all about the preconception counseling of patient with a chronic hypertension as written in the NICE guideline. Thank you so much for